International trade is the exchange of goods and services between countries. Trade affects the economies, environments, and health of nations and people across the world. One of the ways that we can understand the impact of trade on human health is through commercial determinants of health. The World Health Organization defines the commercial determinants of health as the conditions, actions, and emissions by corporate actors that affect health. Although some commercial practices such as trade and commerce can be helpful, many are harmful to health. For example, the way that tobacco, alcohol, and food corporations market and sell their products can be harmful to health. Corporations use trade and investment between countries in two important ways that impact health. First, they lobby trade negotiations to lower barriers to trade and make it easier to sell their products. For example, corporations might lobby to remove or reduce tariffs, which are taxes on imported goods. This increases people's access to unhealthy products, such as tobacco and processed foods and drinks, especially in poor countries. Research shows that lower tobacco taxes increase the use of tobacco and can lead to increases in cancer, heart disease, lung diseases, and stroke. Lower taxes on processed food and drink have a similar effect. When processed foods and drinks or junk food is cheaper, people eat more of it and eat fewer fruits and vegetables. This has contributed to a global rise in obesity and diseases such as cancer and diabetes. Second, corporations lobby for trade agreements that give them more power over governments. Corporations use these trade agreements to threaten and sue governments. They hope that the government will act in ways that will help the corporation rather than citizens. For example, research shows that including warning labels on tobacco products can discourage people from buying and using tobacco. Many governments have passed laws that require warning labels on cigarette packages and other tobacco products. This decreases tobacco sales, which is good for public health, but bad for tobacco companies. Using free trade agreements, these companies have sued governments to remove or change the warning labels. These legal challenges are very expensive for governments, especially those in lower income countries. Many governments fear being sued by tobacco companies, so they sometimes weaken or withdraw their laws so that the warning labels will not affect tobacco sales. As a result, trade agreements can make it difficult for governments to reduce tobacco use and tobacco-related diseases such as cancer. But there is some hope. The World Health Organization and wealthy donors such as Bill Gates and Michael Bloomberg are concerned about commercial determinants of health. They provide financial support to governments and public health agencies. This helps local health organizations and governments to fight corporate threats and legal challenges. Other groups work together to revise and remove harmful clauses in trade agreements. Health, environment, and human rights groups are very interested in this work. They often work together to remove the rules in free trade agreements that allow companies to sue governments. When the rules are gone, governments can more easily pass public health policies that help reduce diseases. It's important that the public knows more about commercial practices that are harmful to health. We must all work together to educate the public, policymakers, and public health workers. We can do this by using videos, flyers, pamphlets, and other media. We can tell stories using traditional media such as newspapers or social media. The important thing is to expose harmful commercial practices so that things can change. It is also important to be active participants in government decisions. You can get involved by calling, emailing, or texting policymakers, monitoring corporate activity, and pushing for transparent trade policies. If you'd like to know more, follow the American Public Health Association's Trade and Health Forum at Twitter at APHA Trade, or email us at tradehealthforumapha@gmail.com.